Have you ever woken up in a cold sweat because you dreamt you had no teeth? Do you know someone who is pregnant or has diabetes? If neither of these questions apply to you, let me ask you this. Do you or someone you know have teeth? As a former dental assistant, my goal today is to express the need of taking care of our teeth through proper brushing and flossing techniques. I will be explaining what our mouths consist of, why it's important to keep them clean, and how to do so using the tools available to us. So what are our mouths made of? The clinical or visual part of our teeth is made up of enamel. This material is prone to dental caries or cavities. Our teeth are held into our jawbone or alveolar bone by the periodontal ligament, a soft tissue fiber that runs the length of the root of the tooth. And everything is covered by soft tissue called gingiva, or our gums. Plaque is a creamy byproduct of more than 700 species of bacteria identified in one's mouth, as found in a 2005 study by the Harvard School of Dental Medicine and the Department of Molecular Genetics. Calculus, which is more commonly known as tartar, is calcified or hardened plaque. When calculus develops supragingivally above the gum, it can lead to dental caries. When it develops subgingivally under the gum, it can lead to periodontitis, a disease of the supporting tissue. Periodontitis has several levels of severity, beginning with gingivitis. This model shows that on this tooth, this side of the tooth shows healthy gingiva, while this side shows gingivitis, inflamed gingiva that would be prone to bleeding. These three teeth model early, moderate, and severe or advanced periodontitis. As calculus gravitates subgingivally, the bone is diminished, exposing more of the tooth and increasing mobility. So why should we keep our mouths clean? Those who don't keep healthy flossing and brushing habits are at a higher risk of developing cardiovascular disease as well as respiratory infections, according to Bird and Robinson, authors of Modern Dental Assisting 8th edition. Those with diabetes are at a higher risk of developing periodontal disease, and expecting mothers are at a higher risk for delivering preterm low birth weight babies. As a surgical assistant in a periodontal office, we treated many patients who were diagnosed with periodontal disease. In addition, I volunteered several times for a dental charity where we would spend the entire day removing unhealthy teeth. In both scenarios, we had patients who didn't want to lose any of their teeth. And there were other patients who couldn't have cared less, opting for their teeth to be extracted and replaced by a removable denture or a fixed denture on implants. Let me caution against this optional easy fix removal of teeth. According to a 2012 study by the Dental School of Oeste de Santa Catarina University in Brazil, chewing disability, or the decrease in the number of natural teeth, produces a significant and negative impact over quality of life. Dental implants and dentures require upkeep just like teeth do, and both cost more in the long run. Mostly, practicing oral hygiene offers and maintains self-confidence and allows us to use our teeth the way they were intended. In the book entitled Tooth by Tooth, a nonfiction children's book by Sarah Levine, we see a friendly rendition of Human Dentition by the illustrator T.S. Spooky Tooth. Generally speaking, every person will have 4 teeth on the top and on the bottom called incisors. These teeth are for biting. In the corners of our mouths, we have our canines, which are meant for tearing. And depending on how old you are, you'll have several teeth in the back of your mouth called molars, which are meant for chewing. So how do we keep our teeth clean? Creating healthy brushing and flossing habits can take some time, but the act itself is actually quite simple. Begin by positioning your toothbrush bristles at a 45-degree angle into your gingiva. Then create small circles with your bristles and move slowly and softly across the surface of each tooth. This should occur twice daily for 2 minutes in the morning and evening. Flossing is most effective when it is brought up between the teeth, over the arch as far as it will go, back down and back up on the other side of the papilla, the peak of gum between each tooth. A note for parents. Please help your children with this. During my time as a pediatric dental assistant, I saw many children who hated the visits to the dentist because they were painful due to their lack of brushing, flossing, and subsequent gingivitis. There is a joke in the dental field that the best time for parents to stop brushing their children's teeth for them is the age of 18. There are many products that allow our efforts to go a long way when it comes to taking care of our mouths. Fluoridated toothpaste, for example, strengthens enamel and prevents dental caries in both adult and baby teeth, depending on how old our children are. And floss comes in many varieties, including expanding floss by the Gum brand, which expands when it gets wet and is able to wick more plaque. We've now come to understand what our mouths are made of, why it's important to keep them clean, and how to develop healthy oral hygiene habits. Heavenly Father has given us the tools and the responsibility to make sure that our teeth and supporting tissue are healthy, and that the same thing can be said of our little ones. Thank you.